Okay, so where's my presentation? Nope. Go on to this. Sorry, I'm terrible at, I don't know.
Minimize this.
Minimize, okay. Sorry, I don't remember how to use PCs. Sorry. Okay, why don't you just, yeah.
There you go.
Oh, am I there? Okay, perfect. Okay, and there should be a, oh, okay, great.
Thanks.
Great, thanks. Thanks, David. You know, listening to you talk about your daughters, like, you know, technology interest has, goes even younger because my 16-month-old granddaughter, one of her first words was phone. Phone, because she likes to look at pictures of herself and family members on the phone, and she FaceTimes with her grandmother on the phone, so she says phone. So really, you know, teenagers aren't the only ones, you know, toddlers, pre-toddlers are doing it. Sorry, I'm not getting my presentation here. How come it's not loading? Unless it's somewhere that I don't see.
Is it, if you click on PowerPoint down there, is that?
Here?
Yeah. What is that?
Okay.
What's that?
Yeah, that's what I was doing, no? Ah, there we go. Okay, see now okay, here we go. All right, I'm a bit of a geek and I love technology. It was kind of a natural progression for me to try to develop more technologically based interventions for patient populations. So what I'm going to talk to you about today is a little bit about the background for the work that we're doing in developing an intervention for couples and for men who are facing infertility concerns. So I don't think I have to tell, nobody will be surprised to know that there are a lot of internet users in the world today, and those numbers are only going to be increasing. I mean, if my 16-month-old granddaughter's already starting, then who knows? But not only do people use the internet for a lot of different reasons, but a lot of people use the internet to search for information about their health. So there have been a bunch of different studies, and you know, people estimate that about 3/4 of internet users actually do search for health information online, and they want to. I mean, it's the most, you know, natural thing now for people to kind of say, I have a headache, I'll go online, see what that means, right? So people look for information about their symptoms, they look for information about different kinds of treatment, they look to see how their physicians are rating on Rate My MD. There are lots of ways in which people use the internet in order to get information related to their health. But this can be a bit confusing for people. I just want to show you a very brief video that kind of illustrates the challenges of searching for online health information. Oops, where's my little thing here? Okay. This is actually a video that was prepared by the U.S. government to promote one of its health websites, but I think it kind of nicely illustrates what I think all of us have experienced in searching for information about health online, that it can be very challenging, that you don't know whether you can trust the information is scary, you have no way of filtering it. So in the field that I've been working in for the past few years, The issue of looking for fertility information online becomes challenging for a variety of different reasons. For example, patients often form unrealistic expectations about fertility treatments from online information. This is what physicians often tell us, that the patient comes in and they think, oh yeah, I'm going to get IVF and I'm going to be pregnant right away, because that's what they've kind of read about online. And also people look for information. It's hard to know. If you Google any question about infertility, the things that come up first tend to be chat rooms, where you're getting people's sort of testimonials or their experiences or opinions. How do you know if that's information is reliable, if it's credible? It's really quite problematic. So a lot of websites are designed as ads, really, for drug companies or for clinics. The clinics advertise more so in the United States than here, but it's a big business, and so the clinics are advertising, our success rates are great, and, come to our clinic and we guarantee you that you'll have a baby, and things like that. So not guarantee, of course, nobody would be that unethical, but I think that, there are a lot of ways in which these websites are ads. And a lot of websites, especially related to infertility, are geared towards women primarily, because fertility is seen as a women's health issue. Even if the male partner is the person who has the cause for infertility, the treatment tends to be on the woman's body. And so most of the information is geared towards women. The other challenge is that infertility is a stigmatized illness. It's not something that people like to advertise or talk about. And so people who have stigmatized illnesses like infertility, HIV is another one, are much more likely to search for information online, because that way it's private, it's in your house, you don't have to discuss it with other people, and so they tend to be looking to access information online. So the challenge, of course, is that people should be able to get information that's reliable, that's credible, that they can understand easily, so that we can really help them to meet their information needs. So our research program, INFOTILITY, is the name of our future app. The app doesn't exist yet, but we're on our way. And it translates nicely into French, INFOTILITY. The goal of this research program is to design and evaluate mobile health interventions for people facing infertility concerns. And our goals are multiple, as you can see. We want to promote reproductive health, so we want to tell people about ways in which they can help themselves lose weight, avoid certain kinds of certain kinds of lifestyle activities that are detrimental to their fertility, and so on. We want to provide patients with up-to-date and accurate information about infertility and its treatment. But our goal is to make it simple, so that people who come from a wide range of educational backgrounds, socioeconomic status differences, immigrants, so that people can understand it, because these are all people who might be accessing our app, and we want to make sure that the information is simple and easy to understand. Our goal is to address not just medical issues, but also psychological and relationship issues, because most websites don't talk about those things. They might tell you, okay, this is what IVF is, and this is how these are the different kinds of treatments that are available. But people don't tend to talk about the emotional, psychological, couple issues that have to do with fertility, and those are really important in improving people's quality of life. And we also want to provide access to peer support. One of the things that we did, I'm not going to talk about this research today, but our prior research on infertility was that many people who experience infertility are actually quite socially isolated. If you're, in the stage of life where everybody around you is having children and you're not, it's a very difficult situation for you to face, and you tend to pull back from your friends, from your family members, and so on, because you think that they don't understand what you're going through, and they probably don't. You don't want to have any pressures, you don't really want to talk about it. So people told us that what they'd really like is to have contact with other people who are going through the same thing, people who will understand what they're going through, and also people who could kind of mentor them through the situation. If you're a new patient and you haven't been, you know, in the treatment process for very long, it's kind of nice to talk to somebody who's been there, done that, and can maybe give you some tips, give you some guidance, give you some support about the process. So we wanted to make sure that we included that component in our app. And also our aim is to link to resources that promote health and well-being. So stress reduction, and so on. So those are our very, very lofty goals for the app. And what I wanted to talk to you about today is the kinds of research that we're doing in preparation for developing this app, because an app doesn't kind of just spring from nowhere. It requires us to do some work in order to make sure that we're not just thinking about what we want, but making sure that we understand what the patients want as well. So we started out by checking out how good the online information was about male fertility. And there are really sort of three criteria that we need to consider when we think about how good is the information. Readability is one quality. The guidelines for readability for information is that it should be at a 6th to 8th grade reading level. So in order for it to be accessible to a wide range of people. Another factor is suitability. So is it appropriate for the target population? Does it really talk about the kinds of things, you know, that it's, you know, supposed to tell you about in terms of a particular illness or a particular treatment modality? And also need to consider things, not only the content, but also the graphics, the layout, you know, is it easy to navigate and so on. And also, are there cultural considerations? Does it only talk about one kind of group of people, or does it kind of relate to a wide range of people who would be accessing this information? The third feature is quality, and so we want to make sure, one would want to make sure that the information is clear, that it's reliable, that it's relevant, that it's, you know, the sources of the information are made clear and so on, so that you know that it's credible. So these are sort of the three features of online information that we sought to evaluate in looking at websites about male fertility. So we did a study to analyze these websites, and this was our sampling strategy. We looked at all the Canadian fertility clinic websites. We looked at 25 North American websites that have information about, or, you know, that are associated with infertility, like the Canadian Fertility and Andrology Society, general, you know, large organizations that provide information about fertility. And then we did a Google search for male fertility and male fertility preservation cancer, because one of our target populations are men who have infertility concerns because they've had cancer or have cancer treatment. So our Google search, we looked at the top 20 Canadian sites, the top 20 English Canadian sites, top 20 French Canadian sites, and the top 20 worldwide sites, as long as they were in English or French, because if they were in other languages, it would have been hard for us to evaluate them. At the end of the day, we had 98 websites that we looked at, and this was a paper that we published. Stephanie Robbins, coordinator extraordinaire, took the lead on this paper, which was published recently. So I'm going to just tell you a little bit about the results, okay? In terms of readability, we found that you had to have a university education in order to understand the websites. None of the websites met the 6th to 8th grade reading level guidelines, so you had to have a high level of education. Only one website was rated a superior, and about only a third indicated when they were last updated. 11% included audiovisual materials, 24% included cultural images and examples, and 20%, this really surprised us, of Canadian fertility clinic websites had absolutely no information about men. So they didn't even include that as part of their programs. So Then we looked at quality, and the overall quality was only in the fair range, and we found that the major North American websites were the best, and the fertility clinics were the worst in terms of quality. Interestingly, Google position was related to quality, so in other words, the first site that you get, or the top sites, were better in terms of quality, but not in terms of readability or suitability. The best features of the websites were how the treatment works and different types of treatment options, and the worst features were the sources of information, the risks of treatment, and consequences of no treatment. So you can really see the gaps in terms of the health information that's presented, and certainly gives some guidance as to how one might go about developing better sources of information. We then went on to do needs assessment surveys of our patient populations to ask them what kinds of information and support they would want. And so we did 2 surveys. Actually, we did 4 surveys, one for fertility patients and their healthcare providers, and another 2 for male cancer patients and their healthcare providers. We asked them about background information, what kinds of information they've received, what they would like, and what their preferred components were for an app. We asked the healthcare providers about information and support that they offer and the ideal components of an app. So again, another paper that we presented in terms of understanding whether men and women search for different information online, which was quite interesting. Most people search for information online about infertility, but more women, a lot more women than men, do search for the information. Men and women were similar in a lot of areas in terms of what they're looking for, information about treatment, and so on. But these were the main differences we found between men and women. So you can see that the women seem to be more in charge of getting the practical information. Where's the clinic? Is my doctor any good? Are there other clinics? And they also want to know more. They also want to have the support of others, learning the experience of others going through infertility treatment. So that was kind of, again, sort of giving us some clues here as to what people are looking for and what kinds of information is important to them. So what did the fertility patients tell us they wanted in an app? They said they wanted it to be free, okay? They wanted it to be easy to understand. They wanted information that promotes reproductive health. They wanted it to be vetted by a doctor, okay? So in other words, they want to be able to rely on the information that they're getting, that it's going to be information that they can count on, that's evidence-based. They wanted information that was gender-specific. So men said, yes, we want to know stuff that's just about men. And women said, yes, we want to know things that are just about women. What did they not want? Celebrity stories was actually last on the list. People didn't want to hear about Celine Dion's successful IVF treatments, okay? That wasn't of any interest. People going through fertility treatment don't want to hear about adoption, okay? Because they want to have biological children right now. They weren't so interested in tracking diet and exercise, and that's, there are many apps out there. It's not something unique to that we could provide. They don't want to know about research that they could participate in. So these were, again, this was very helpful to us in thinking about what is the kinds of information that we're going to include in the app. The male cancer patients was quite similar. They wanted it to be free. They wanted it to be easy to understand, doctor approval. They wanted actually, again, practical information. Is it covered by Medicare? Where can I go to do sperm preservation, for example? So clearly wanting information. They don't want to hear about celebrity stories. They don't want to hear about adoption. So it was quite similar in the male cancer patients. In terms of online peer support, we know that people are going online, going to chat rooms, looking for other support from people. And the reasons for that are clear. It's accessible, it's anonymous, it helps to normalize the illness experience, and it gives access to people who are living through similar circumstances. So who wants online peer support? Both men and women said they were interested in it. And this is research that was done by my student, Paul Grunberg. So just in terms of looking at differences between men and women. Men who had more stress and lower income wanted peer support. People want mobile accessibility, so they want it on their phones. They, again, wanting to make sure that it's monitored by a health professional. They wanted it to be reliable. People who reported a lot of stress said they wanted a space to share their stories. They wanted to be matched to a peer mentor, so they wanted even extra more support. The option of meeting online, so again, kind of accessing support. So when we look at the differences between male fertility patients and male cancer patients, it's interesting to consider this. I'm almost at the end, so I'm wrapping up. Again, this is research that was done by Skye Miner and Davis Domler, who are two graduate students who are working with me. And they took a look to see why would they compare male fertility patients and male cancer patients, because fertility, as I mentioned, is a stigmatized illness, and cancer is not. And so maybe there would be differences based on whether you have a stigmatized illness in terms of your desire for social support. And basically what they found in looking at this, in these data, were the cancer patients did report more stress than fertility patients. Not surprising, because they're having a life-threatening illness and they're going through treatment for that. But men with male factor infertility, so in other words, the reason for infertility is because of something in the male, had similar depression scores to cancer patients. But male fertility patients were twice as likely to want online peer support than male cancer patients. And it's interesting, so there are a couple of reasons why that might be the case. One is that, again, this is a stigmatized illness and they want more support and they want it to be available online rather than face-to-face. But also, it's possible that men just feel left out of the treatment process. As I mentioned, most of the treatments are on the woman's body, and men might feel quite peripheral to this process. So perhaps, again, being in contact with other men in this situation would be beneficial to them in terms of gaining social support. So just to wrap up, we know that people are looking for health information online in increasing numbers, and we know that they want to get reliable and easy to understand source of information and free sources of information. They want it to be mobile, so they want to be able to look at it when they're sitting on the subway, or when they're not necessarily sitting at their desktops. They want practical information. Tell me about what I could expect in the treatment. Tell me where to get the treatment. How much does it cost? Who's going to provide it? And they want contact with other people who are in similar situations. And it's important to tailor the information, because men and women do have different interests and concerns, and that's, again, an opportunity that a mobile health application allows us to do, is letting people choose what they want to do and what kind of information they want to receive. So we're hoping to launch this app in the near future, and we'll keep you posted on how it works out. I just want to thank, there's no way to do this work without a wonderful team of co-investigators and students and volunteers, and I just want to acknowledge their very excellent and hard work in this research program. Thanks so much.